If someone told you that you could be slowly losing your vision right now, and not even know it, would you want to find out? That's the reality for millions of people living with glaucoma. It's one of the leading causes of irreversible blindness worldwide, and yet it often gives no warning until significant damage has already been done. In this video, we're going to break down exactly what glaucoma is, what it does to your sight, and what modern medicine can offer in terms of treatment. Whether you've just been diagnosed, you have a family history, or you're simply looking to stay informed, stick around, because this one matters. Glaucoma is actually a group of eye conditions, not just one disease, that damage the optic nerve, which is the cable that carries visual information from your eye to your brain. When that nerve is damaged, your brain stops receiving a clear picture and vision is lost. The most common form is called open-angle glaucoma. In a healthy eye, fluid called aqueous humor is constantly produced and drained to maintain a stable pressure inside the eye. In open-angle glaucoma, that drainage system becomes less efficient over time, a bit like a slow drain in a sink. Pressure builds up and that excess pressure gradually damages the optic nerve. There's also angle closure glaucoma, which is less common but more dramatic. The drainage angle becomes physically blocked, pressure spikes suddenly, and it can cause severe eye pain, headaches, and rapid vision loss. This is a medical emergency. And then there's normal tension glaucoma, which is particularly tricky. The optic nerve is still damaged even when eye pressure is in the normal range. Researchers believe blood flow issues and nerve sensitivity play a role here. The key thing to understand is that in most cases, glaucoma develops silently. There's no pain, no obvious symptoms in the early stages. By the time you notice something is wrong, meaningful vision loss has often already occurred. Now let's talk about what glaucoma actually does to your vision, and who is most at risk. Glaucoma typically attacks your peripheral vision first, the edges of your visual field. Most people don't notice this early on because the brain is remarkably good at filling in gaps. Over time, if left untreated, that tunnel narrows further, and central vision can eventually be lost too. And critically, that damage is permanent. Unlike some conditions, vision lost to glaucoma cannot be restored. So who's most at risk? Several factors increase your chances. Elevated eye pressure is the most well-known risk factor, though not the only one. Another is age, with the risk increasingly significantly after 60. Family history. Having a first-degree relative with glaucoma raises your risk considerably. People of African or Hispanic heritage are at higher risk, often affected at a younger age. Having myopia, nearsightedness, particularly high myopia, and previous eye injuries or long-term use of corticosteroid medications. This is why regular eye exams are so important, especially if any of these risk factors apply to you. An ophthalmologist can measure your eye pressure, assess your optic nerve, and test your visual field, often catching glaucoma long before you'd ever notice it yourself. Now for the important question, what can actually be done about it? The good news is that while glaucoma cannot be cured, it can absolutely be managed, and in most cases, treatment is very effective at slowing or stopping further vision loss. Eye drops are typically the first line of treatment. These work either by reducing the amount of fluid the eye produces or by improving drainage. There are several classes available, and finding the right one, or combination, for each patient is something your eye doctor will tailor to you. Laser therapy is another well-established option. A procedure called selective laser trabeculoplasty, or SLT, uses a laser to improve drainage in the eye. It's minimally invasive, done in an office setting, and is now often recommended earlier in treatment than it used to be. For more advanced cases, surgery may be necessary. Procedures like trabeculectomy or the implantation of drainage devices create a new pathway for fluid to leave the eye and reduce pressure more dramatically. There's also a growing category called minimally invasive glaucoma surgeries, or MIGS, newer procedures that aim to lower pressure with less risk and faster recovery than traditional surgery. The most important thing to understand about treatment is this: consistency matters enormously. Because glaucoma is a long-term condition, staying on top of your medication, keeping your follow-up appointments, and monitoring your visual field regularly are all essential to protecting your sight. Glaucoma is serious, but it is manageable, and knowledge is your first line of defense. If you haven't had a comprehensive eye exam recently, please make that appointment, especially if any of the risk factors we discussed apply to you. If you want to go deeper on this topic, I've put together a book that covers glaucoma in much more detail, and I also have a tracker designed to help patients stay on top of their symptoms, medications, and appointments. Links to both are in the description below. I'd encourage you to check them out. If you found this video helpful, please give it a like, share it with someone who might need it, and subscribe for more content on eye health. I'll see you in the next one.